Introducing MyHealthPassport. This quote illustrates what we learned from our pilot project. We learned it is better to start small and build rather than try create the perfect solution from the get-go. So let us tell you a bit more about our project and introduce Frank. Frank is a 78-year-old man with diabetes. He recently moved to live with his daughter. Last week he felt unwell and his new GP arranged an MRI in a private facility and an urgent appointment in a local hospital. Frank wrote the appointment down on a piece of paper so he wouldn't forget it. 2 weeks later, Frank attends his hospital appointment. His daughter had to check his appointment because he lost the piece of paper he wrote it down on. It's the first time Frank has attended this hospital, and registration takes a long time. Frank finds he has to answer the same questions at each healthcare encounter. When he sees the doctor, his MRI results are not there because Frank forgot to change address at the MRI facility and his demographic details didn't match and his results never got filed to his chart. Frank brought a list of medications, but he forgot the name of the medication he's allergic to. He can't follow what the doctor is saying, but he hopes the GP letter will clarify. 2 weeks later, no letter has been received by Frank's GP, as the wrong address was recorded for the GP at the hospital reception desk. Frank feels his encounters with the health service are more complicated than they should be, and he thinks it's because his healthcare providers don't seem to talk to each other. We came up with the health passport concept with Frank in mind to help him navigate our healthcare system more easily. Our digital solution is aligned to the patient-centred Sláinte Care strategy. Realising that the health passport was an ambitious project with huge potential, we set out to 1. Identify the minimum data set to uniquely identify a patient across different healthcare settings. 2. Create an interface with the IHI register. 3. Ensure patients' correct GP details would be recorded. And 4. Create a prototype to store all this data. Designing the prototype involved creating a requirement document, workflows, a work breakdown structure, a Gantt chart, detailed patient data tables referenced to our dataset, data content for numerous tables, screen mock-ups for every screen of the prototype, and detailed FAQs. Let's proceed to a demonstration of the prototype.
This is the login page for MyHealthPassport. On this web page, we have the option to create a new account. To create an account, we enter a unique username, a unique email address, a password, and a mobile phone number. This website uses two-factor authentication. We need to verify both mobile, phone, and email address, and this is achieved using Twilio API. Once they're verified, the basic Health Passport account is created and we're brought to the registration page. For this demo, we'll enter the details of a test case so we can demonstrate how an API is retrieved. We'll add the demographic details including name, date of birth, gender, mother's maiden name, and PPS number. In our requirements, we ensured only essential details were mandatory. We have an API to the Aircode Finder. So entering an Aircode or first line of an address will locate a full address. The address auto-populates the relevant fields. The address could also be entered manually. A photograph can be uploaded if desired. The next page is GP details, and here we'll demonstrate the link to the GP service directory. We can enter a GP's name, search for the GP, and his name and contact details will appear. Once the GP has been selected, we can opt to verify the GP. This sends a message to the GP via HealthMail. When the GP responds, the status of the GP is updated to verified or denied. The final registration page allows us to retrieve an IHI. Assuming the details we've input are correct, the matching IHI will be retrieved. With registration complete, this is what our health passport looks like. We can add and update information at any stage. For example, we can add other healthcare professionals involved in our care and any appointments we may have with them. We could also add allergies. And we can record other health identifiers at hospitals we may be attending and in that way link them to our IHI.
So what have we achieved? We have delivered a working prototype of an electronic health passport. Critically, we have gained access to the IHI register so that MyHealthPassport can retrieve and store a patient's unique IHI. We have gained access to the GP service directory, ensuring that the correct GP name and contact details are recorded in the passport. We have devised a novel way using HealthMail to verify this important GP relationship, recognising it is the GP who carries the primary responsibility for coordinating a patient's care. Finally, our solution redresses the balance of power in healthcare towards the patient by giving them control over their data. So how does MyHealthPassport add value? Firstly, it is a digital solution that is immediately available and can precede the electronic health record and patient portal. As it stores a patient's IHI, a patient can now be uniquely identified across all healthcare settings. It streamlines the patient registration process, leading to a better patient experience and saves valuable patient and staff time. The recording of data is more accurate and consistent. It improves communication and information sharing across different healthcare settings, key to promoting integrated care as recommended in the Sláinte Care Report. And it will encourage the more widespread adoption of the IHI with all its benefits for patient safety. So what about the future of MyHealthPassport? Attaching a QR code to the homepage could pave the way for pre-registration and self-registration. Providing an access portal for healthcare providers would allow them to view individual records, subject of course to a patient's permission. As MyHealthPassport stores an IHI, there is nothing to prevent it from seamlessly integrating with other e-health solutions such as NIMIS, Medlist, e-prescribing. Crucially, it could link with COVAX, the HSE COVID-19 vaccination management system, and the HSE COVID-19 testing system, forming the basis of a vaccine passport. So what are our three take-home messages? 1. Let's not wait for the rollout of a national electronic health record. 2. Poor communication is cited as the single biggest risk to patient safety, so a project like this that improves the communication process should be seen as a priority for funding. 3. We all know about the success of Revenue's My Account. So what about MyHealthPassport? Thank you for listening.